this poster has to be removed so that
we are live, sir.
Okay.
Okay, should we start, sir?
Yes.
Yes.
Hello.
Please start.
Should we start, Shinde sir?
Yes, Praveen sir. You can start. We are live.
Okay, a very good evening to all the respected audience. Today, the Maharashtra Animal and Fishery Science University, Nagpur, the two constituent colleges of this university, Postgraduate Institute of Veterinary and Animal Sciences, Akola, and College of Veterinary and Animal Sciences, Parbhani, have jointly organized an international webinar entitled as Let's End the Rabies through Collaboration and Vaccination on this auspicious day of World Rabies Day. So I welcome all the participants who have joined this international webinar on behalf of organizer. I would like to introduce the chairman of today's program or this international webinar is our Honorable Vice Chancellor, Professor Colonel Dr. A.M. Paturkar sir. And today we have bestowed with a chief guest, Mr. Karunanidhi sir, who is a Senior Vice President of Alembic Pharmaceutical Limited. For this international webinar, we have also the guest of honors, the dignitaries of our university, DI and Dean, Professor Dr. A.P. Somkur sir, Director of Research, Dr. N.V. Kurkure sir, and Director of Extension and Training, Professor Dr. V.D. Aher sir. For this today's program, we have convener Dr. N.M. Markandeya sir, Associate Dean of College of Veterinary Animal Sciences, Parbhani, Maharashtra. And we have an eminent speaker for this topic, Professor Dr. A U Bhikane sir, who is Associate Dean of PGIVAS, Akola, Maharashtra, and also the President of VIPM. So, for this webinar, I am very glad to welcome all the dignitaries, the speakers, the organizer, on behalf of organizer. So, today we'll have a very interactive session on the occasion of this World Rabies Day. So, now I will request our chief guest, Mr. Karunanidhi sir, for welcoming the speaker and his presidential address to the audience.
Thank you, Dr. Praveen Bankar. I take this opportunity as a blessing for Alembic, and I am honored to be a chief guest here. Actually, today is the World Rabies Day, which is celebrated, or you can say it is observed on the day of 28th of September. And this is the only global day of awareness and action for the prevention of prime zoonotic disease, that is rabies. There are other zoonotic diseases, but rabies is very fatal and very really serious disease. In the previous webinar, I was observing that it is affecting less number of people, but if it affects, it is deadly. So this day marks the death anniversary of the French biologist Louis Pasteur, who developed the first efficacious rabies vaccine against this particular disease. And he invented that disease. I'm very proud, and I would like to share that he invented that disease. Invented that vaccine. That time he was working in Ooty, Nilgiri district, which I am very close to Coimbatore. I am sitting some 60-70 kilometers away from that institute. So that is the connection he has with India. And today, that is 2020, the World Veterinary Rabies Day is the 14th anniversary, because last 14 days it is being observed. The main theme is focusing on vaccination, collaboration to end the rabies. The primary goal of this entire program or this observation for this year is to end rabies death in India by 2030. And also by explaining importance of dog vaccination, post-exposure prophylaxis, and the need for united effort towards achieving elimination of this transboundary disease. According to World Health Organization, India is accounting for 59% of the total 35,000 human deaths reported in Asia due to rabies, post-bite rabies in human. So veterinarians have a pivotal role in implementing these strategies at the national and regional level, and their involvement is vital element in coordinating operations among public health services, local authorities, law enforcement agencies, and NGOs working in different areas. The prevention and control of rabies by vaccination of animals, control of stray dogs population by animal birth control programs being implemented by various local authorities or various animal welfare organizations, prompt diagnosis and reporting of disease in time. Also, the rabies surveillance and awareness among the public are few of the very important due of the veterinarians, because only veterinarian can educate this to the general public. On this occasion, I have great pleasure to introduce today's speaker, eminent speaker, and he has conducted versatile, different type of subject he has spoken. I have seen a few of his programs. I have introduced Dr. Anil Bhikane sir in some of our webinars, and today he is a speaker. He is an associate dean of postgraduate veterinary and animal science college at Akola, which is part of Maharashtra Animal and Fisheries Science University, and he is a president for Veterinary Internal and Preventive Medicine Society of Maharashtra chapter. He is an eminent academician, passionate to improve animal health through his clinical experience and various extension activities. He also does social work, Jeevala Foundation and Green Army in Udgir. He has dedicated 30 years of his life to establish veterinary college in Udgir. Also, he has tirelessly, selflessly worked over these years for the betterment of the farmers. He has never done private practice. He always requests or advise the farmers to bring their animal to the college so that the animal will get a best treatment. Also, his student can have first-hand exposure. So he has published more than 211 research papers in national and international journals, along with more than 173 popular articles. He has 25 radio talks to his credit and 17 TV talks. He has authored 7 books and edited 3 booklets on animal and veterinary sciences. He delivers lectures for the farmers on more than 502 occasions and for veterinarians more than 101 occasions. He also has organized more than 425 animal health camps. So Dr. Bhikane sir has been recognized at various level, national and international level. Dr. Bhikane sir was elected as an active member of New York Academic Sciences. He is listed in all the editions of Who is Who in the world, published by an organization called Who is Who in America since 1997. His biography also appeared in the Outstanding People of 20th Century, published by International Biographer Center, Cambridge, England. Dr. Bhikane sir is recipient of 31 prestigious awards and honors for his research and extension activities, which some of the point I would like to highlight is a recipient of Best Teacher Award in 2008, Best Teacher Scholar Award in 2009, and Best Extension Worker Award in 2016 of Maharashtra Animal and Fisheries Science University, Nagpur. 3 national prestigious gold medals, Gandhi A. Sastri 2001 and DC Blood in 2008, and Gorakchak Manli Gold Medal in 2014. We have such a wonderful and eminent speaker, and he is a great orator. And also I would like to mention here that Alembic is very, very active nowadays in all the webinars, and that credit goes to 2 personalities. One is definitely Dr. Bhikane sir and another one is Dr. Markandeya sir, because when we started these webinars, we wanted to do these webinars during this lockdown period, and these professors supported us and they said we will do it first. After that, we got the recognition from other universities and we have been doing with many universities now. So I take this opportunity to thank Dr. Bhikane sir once again, and over to Dr. Bhikane sir.
Thank you, sir, for your valuable presidential address. Now, I would like to request our eminent speaker, Professor Dr. Bhikane sir, to share his views on this international webinar. Let's end the rabies through collaboration and vaccination. I would like to mention again, for this program, the knowledge partner, Alembic Pharmaceutical Limited, has played a very vital role. So I'm thankful to the presidential remark by the chief guest, Mr. Karunanidhi sir. So I'm handing over to speaker, Dr. Bhikane sir, please.
Thank you, Praveen. So at the outset, I extend my warm wishes to all the audience participants on your World Rabies Day. Actually, I'm very much thankful to Dr. Karunanidhi for introducing me at length and using good words about me. Actually, it is Alembic and Mr. Karunanidhi who helped us in providing this good platform for this particular webinar. I'm also thankful to Dr. Markande sir, Associate Dean, Dr. Syed Mujib, Dr. Siddiqui, and others from COVAS Parbhani for inviting me as a speaker for this particular webinar. We are celebrating this World Rabies Day for the last 14 years. For the first time, is it visible?
Yes, sir.
For the first time, the World Rabies Day was celebrated in 2007. And since then, it is being regularly celebrated in almost all countries of the world. We are also participating in this celebration for the last several years by organizing different activities. So all over the world today, the vaccination programs, awareness programs, they are being organized. And as a part of this celebration, the COVAS Parbhani and PGIVAS Akola, under the banner of Maharashtra Animal and Fishery Sciences University, in collaboration with Alembic Pharmaceuticals, have organized this international webinar on a theme which is being given this year. That's Let's End Rabies through Collaboration and Vaccination. So this first World Rabies Day was celebrated in 2007 by Alliance for Rabies Control and Center for Disease Control and Prevention, with co-sponsorship from World Health Organization and OI. This was celebrated on 28th September every year to commemorate the death anniversary of Louis Pasteur. our chief guest told in his inaugural address that the Louis Pasteur, he's the scientist, French scientist, he's the French microbiologist who actually invented this rabies vaccine. And he's the person who has, in the real sense, led the foundation stone for the rabies control program some 135 years ago. FAO, OIE, and World Health Organization, they have set goal to reach 0 human deaths from canine rabies by 2030. So in 2015, this was decided, this goal was set by these 3 important organizations, topmost organizations in the world. And these 3 organizations, they are working together to create a global awareness about rabies amongst the people. We consider that the mass vaccination of the dog is one of the major control measure for the rabies. But apart from this, the community participation, education, and public awareness are important elements of a successful rabies control program. Nowadays, good number of vaccines they are available in the market, that too in a sufficient quantity. Even then, many of the countries, they are unable to control the rabies because the participation of the people is lacking. And therefore, there is a need to increase the participation of the people in this rabies control program. And in order to increase the participation of the people, of the public in this particular program, there is no need to perform extensive type of extension education. Then and then only it is possible to control this rabies. There is also dire need to make a collaborative efforts among the human health systems, veterinary health department, the different corporates, and the non-government organizations. And I feel very happy that many of the companies, private firms from the corporate sector, they're getting involved in creating awareness about rabies among the people. And even today, Alembic Pharmaceutical is our knowledge partner, and it is involved in this particular awareness program. Many of the non-government organizations, they are also playing a key role in organizing mass vaccination campaigns and awareness programs throughout the world. This year, because of this corona pandemic, we are unable to organize the actual programs. Many of us are unable to organize the actual programs. But this time, many of the institutions, they have come forward and organizing this online type of awareness programs. Really, this World Rabies Day is an opportunity to establish or strengthen the link between the public sector, private sectors, corporate sector, and among the masses. So today we are using this as an opportunity to link the people. The rabies is known for 3000 years BC. The word rabies is derived from a Latin word rabere, which means to rage or rave. The Latin word in turn finds its roots in a Sanskrit word rabas, to do the violence. The Greek referred to rabies as a lysa, which means a frenzy or a madness. They also called it as a heterophobia. in human beings because the affected humans, they have fear for water. So these are the references about rabies. You all know that rabies is 100% fatal in animals as well as human beings. But at the same time, it is 100% preventable. And therefore, we have to work on prevention of rabies. According to World Health Organization, every year, 59,000 people, they are dying of rabies all over the world. 95% of the deaths, they are from Asia and Africa. That means these are the two continents where this disease is highly endemic. 20,000 people, they are dying in India. See, out of 59,000 people, 20,000, they are dying in India. Means India is highly vulnerable, you see, to this particular rabies. As far as the incidence of rabies in human beings is concerned, 50% cases, they are occurring in the children below 15 years of age. Those are the school students, because they are short, they are having a short height, and therefore dogs, they used to bite on the face and the hands. These are the portions which are very near to the brain, and therefore the children, they are more vulnerable. Many times the children, they hide the information even if they are bitten by the dog. And therefore the post-bite vaccination schedule, post-exposure vaccination schedule, it is not being undertaken on time. In India, there are 19 million pets and 35 million street or stray dogs. The stray dog population is more vulnerable for rabies, and these stray dogs are really responsible for the urban rabies. They are the major culprit for the rabies. The disease is prevalent in all continents. It is prevalent in more than 150 countries of the world. But there are some continents, you see, it is almost prevalent in all the continents except Antarctica. It is prevalent, I already told, most of the countries, but there are some countries which are free of rabies, including the Australia, New Zealand, United Kingdom, Spain, Japan, Singapore. India is more vulnerable and the disease is endemic. It is in a high-risk zone. But even in India, Andaman and Nicobar Islands, they are free of rabies. When we talk about the occurrence of the disease in the different animal species, rabies is a disease of mammals. It is a disease of warm-blooded animals, which includes all animals. But among the animals, canines and felines, they are highly susceptible. Ruminants and equines, they are moderately susceptible. Frogs, birds, snakes, means reptiles. So reptiles, birds, and amphibians, they do not suffer from the rabies. Just to see this map, this indicates the prevalence of rabies all over the world. Here you can see that the disease incidence is very high in African countries as well as the Asian countries. So as far as India is concerned, India, Nepal, Bangladesh, Pakistan, so disease incidence is very high. The disease is highly endemic. You all know that rabies is a viral disease caused by a neurotropic virus which belongs to family Rhabdoviridae and the genus Lysa. It is a bullet-shaped virus, single-stranded RNA virus, having the size of 180 by 75 nanometers, lipoprotein envelope, knob-like spikes on the bone. So this is the virus, the bullet-shaped virus. So it is better to know the characteristic of virus. See, the virus, it is a very deadly disease. Rabies is a very deadly disease. Virus is a very dangerous type of virus. But this virus is very fragile. This virus is very fragile and very sensitive to the most standard disinfectant. It is highly virulent and causing a severe fatal disease when it enters in the animal body. But you see, this virus is very fragile and sensitive to the most of the disinfectants like iodine and alcohol. Iodine, alcohol, ether, formalin, acetone, soaps, even a simple soap or simple detergents, they can kill this virus. The virus dies in a dried saliva in a few hours. So it doesn't survive for a long period outside the body. It is secreted no doubt through the saliva. But when saliva gets dried, the virus gets inactivated. The virus is destroyed again at a 50 degrees centigrade in 1 hour. But at pasteurization temperature, it is 60 degrees centigrade, it gets inactivated within 5 minutes. And at a boiling temperature, it gets inactivated immediately. This virus, already I told, it doesn't survive for a long period outside the body. But this virus is very much resistant to the cold. It survives in the refrigerator, deep freeze particularly, for many, many years. See, it survives at minus 70 degrees centigrade for many years, and even at 0 to 4 degrees centigrade for months. This virus is very stable at extreme pH. So what are the sources of infection? Actually, saliva of the infected animal is the main source of infection. And there are 3 important reservoir hosts. Based on that, rabies is classified as urban rabies, wildlife or sylvatic rabies, and the bat rabies. These are the 3 important reservoir hosts. So first one is the urban rabies. Urban rabies is spread by the dogs, infected dogs, and to minor extent, lesser extent, cats have been the main source of infection for the human beings as well as for the animals, for both. So just I would like to share that a single infected dog is capable of transmitting the disease over an area of 40 kilometers. So a mad dog may run away and may cross the distance of 40 kilometers and may transmit the disease to any place. So this is about the urban rabies. Then another is the wildlife or a sylvatic rabies. Wildlife rabies is also called as the sylvatic rabies. This is spread by the wild animals. They are again a major source of infection to the human beings as well as the domestic herbivorous animals, where the domestic carnivora is well protected, where the countries where the dog population is vaccinated, where the rabies is controlled in the dogs and cats. In those countries, wild animals, they are mainly responsible for rabies. They transmit the infection not only amongst themselves, among the different wild animals, but they also transmit the infection to the dogs as well as human beings. Foxes, wolves, bats, mongoose, squirrels. So they are responsible for sylvatic rabies. Then the third type of rabies, that is a bat rabies. Bats are the carriers of infection. They do not exhibit the signs of rabies, but they carry the infection and they act as a reservoir host They are the source of infection to the man and animals. They transmit the disease by bite and even through aerosols in the cave. They reside in the caves, so they may transmit the infections. So particularly bat rabies is found in the Latin America. This particular bat rabies has not been reported from India. So India is concerned about the urban rabies mainly, and to some extent about the wildlife rabies. Actually, wildlife rabies is mainly responsible for rabies in countries like United States. Apart from these three reservoir hosts, there are some other animals which can also spread the disease. Sometimes this question is being asked whether monkeys they transmit the disease. Yes, they can transmit the disease, but usually rarely. So they may acquire the infection from the other animals and they may transmit the disease. Rat bites, there are two schools of the thought, but sometimes or rarely, rat bites have been reported to transmit the disease. Horses and donkeys, they get aggressive. Actually, they get the infection or they pick up the infection from the dogs and wild animals. And when they suffer, they become aggressive and they may bite. They bite. When the furious, excited horses and donkeys, they may bite the other animals or they may bite even human beings. So apart from wild animals, wild canids and felids and domestic canines and felids, the horses and donkeys suffering from rabies, they can bite and spread the disease if they are affected with rabies. However, the domestic cattle and buffalo, they are rarely a source of infection because even a rabid cattle and buffaloes, they do not bite to other animals. But they may rarely transmit the infection to the human beings, particularly when the cattle and buffaloes suffering from rabies, they are being handled by the human beings. Here, this picture depicts the rabies transmission cycle. You see usually canines, they are the reservoirs, bats and the wild animals, they are the reservoirs. And they are transmitting, these are the non-reservoir domestic animals. They are transmitting the infection to the cows and human beings and even to the horses and donkeys and other animals. According to WHO, 91% cases, they are due to rabies. 91% cases, they are due to dog bites. 2% cases, they are due to cats. 3% cases, they are due to domestic animals like cattle, buffaloes, etc. 2% cases all over the world, 2% cases, they are due to bats, 1% due to foxes, and 1% due to other wild animals. So this clearly indicates that dogs, they are mainly responsible for the rabies in animals all over the world. Especially in India, 96% cases of rabies, they are due to dogs. Whereas in United States of America, where the canine rabies has been controlled by mass vaccination, wild animals, they are mainly responsible for the sporadic cases of rabies. So 93% cases of rabies in United States, they are due to wild animals. How the disease is transmitted? Here you can see the bite of an infected animal is most important. That is the main mode of or a route of transmission. Bite by infected animal, and a contamination of the skin wounds by fresh saliva. Yes, this is the route of infection sometimes, but mostly the dog bite, that is used. Many times this question is being asked whether this virus is transmitted by inhalation or aerosol route. Answer in general is no. But rarely this rabies virus may be transmitted by aerosol route, particularly among the bats in the caves. And the laboratory workers or the scientists who are working in the rabies laboratory. So this route is a very rare route of transmission. Another, ingestion. Very rarely, again, the ingestion may be the route of infection. Very rarely. Particularly eating of bats died of rabies has been suggested as one of the cause. But it is very, very rare. Uncooked meat of a rabid animal sometimes or very rarely may transmit the disease. This is again very interesting information I would like to share, that the virus is excreted in the saliva 3 to 8 days before onset of clinical signs. So here the dog or any other animal doesn't show the signs of rabies, but may secrete the virus through the saliva 3 to 8 days, and on an average 5 days before onset of clinical signs. One more information I would like to share, that not all bites from rabid animal result in infection, because virus is not always present in the saliva. Actually, virus is secreted through salivary gland in the saliva, but it is not always present in the saliva. So sometimes even the bite by the rabid dog may prove unfruitful and may not result into the rabies. But in 50 to 60% cases of a rabid animal bite, the rabies develops. Presence of virus is rare in the blood, milk, urine, and other secretions. Sprayed through milk is unlikely. Now it has been confirmed there is no record of sprayed of this disease through milk. The disease may spread from one human to human. As far as human to human transmission is a very rare. But a handling of a human case of rabies by a caretakers without using proper protective equipments by the animal health, human health workers or the doctors, in that case, the rabies may be transmitted from one human being to the another, but it is very, very rare. But organ transplant may lead to the transmission of rabies. Particularly the cornea collected from the human being died of rabies. Mucous membranes exposed to saliva, even the virus gain access through intact saliva. This is very important. Intact mucous membrane. So even without breach in the continuity of mucous membrane, this virus may enter through this mucous membrane. Now, how the disease develops? Virus enters via animal bite or a wound. This is the major route. Very rarely the other routes of infection, they are responsible for the disease. So in 99.99% cases, it is the animal bite which is responsible for the rabies. So virus enters via animal bite or wound. Then this virus replicates in the muscle at the site of bite to 48 to 72 hours. Then this virus infects the peripheral nerves. So whatever nerves they are situated in that bitten area, so they are being infected. And from that point, the virus travels to the spinal cord and to the brain in a centrifugal manner, retrograde manner. So virus is not transmitted through blood. Very interesting, very important thing. The virus is not transmitted through the blood, but it is transported via nerves. Virus travels at the speed of 3 millimeter per hour. That means nearly 7 centimeters. Some scientists have mentioned that it travels at the rate of 1 to 2 centimeter per day. So one of the researcher has also mentioned that it travels at the rate of nearly 7 centimeter per day. From the site of bite, this is the site of bite, towards the brain. The virus travels from brain via nerves to other tissues. Once it reaches to the brain, again from the brain, it traverses to the different organs via the nerves and reaches to the eyes, particularly in the cornea, and the salivary glands centrifugally. Means first it reaches to the brain centripetally, and then from brain it reaches to the different organs centrifugally. So just this is the figure which depicts how this virus reaches to the brain and then other organs. After a dog bite, you see, the virus is being injected in the muscles. From that point, through the nerves, it reaches to the spinal cord and then to the brain. And from brain, it is it is going to the cornea and the different kidney and the salivary glands. So this is the way how the virus reaches. So there are different factors which affect the incubation period. So the incubation period varies from species to species, age to age. It is variable. It is in days or even in years. So incubation period varies from few days to several years. So here in human beings, it is 30 to 90 days, 7 days to 3 years. Even I have seen and read the literature that in some cases the signs were observed within 4 days of dog bite also. So there are records of even disease on 4th day of rabid dog bite. Here I would like to share this interesting information that 85% of the cases, in 85% of the cases, the incubation period is up to 60 days. So generally, 85% of the cases, they occur within 15 days to 60 days, means up to 2 months. Only 14% cases, they occur between 2 to 3 months. This means 99% of the cases, they are occurring within 3 months of dog bite. After 3 months, only 1% of the cases they are occurring. So it is very rare after 3 months, very rare. There are records of occurrence of rabies even 20 years after the dog bite also. But that is a very remote and a very rare example. In general, 99% of the cases they are occurring within 3 months of dog bite or rabid animal bite. These are the various factors which affect the incubation period. Why the incubation period is short in some animals, why it is long in some animals. So these are the reasons. Severity of the bite. If bite is very severe, means if the wound is very severe, if it is very large, then definitely the incubation period is short, because the virus concentration at the site will be more and it will spread rapidly. The number of wounds, if there are more number of bites by a dog, sometimes there will be 3-4 bites caused by dog. So in that case, definitely the incubation period is short. Then amount of virus injected, this is again very important. Already I have shared, sometimes the virus may not be present in the saliva of even a rabid dog. Therefore, the concentration of the virus, amount of virus injected through dog bite is important. More the amount of virus deposited, more shorter the incubation period. Another interesting information I would like to share, that age of animal. It matters a lot. In young animals, the incubation period is always short. In children's, incubation period is always short. One of the reason age factor may be working, but the important you see, in young cows, I have seen that most of the dog bites, they are on the head and face region. Because whenever a dog comes nearby, they shake their head, or they try to, you see, throw that dog, hit the dog, and that may lead to bite over the head and face region. Even the children's, they are bitten over head and face or hands. Then distance of bite from the CNS. This is very important, that if the bite is very close to the head and face region, it is close to brain, I will say. If it is on head and face, the incubation period is the shortest. If it is on hand, the incubation period is shorter. And if it is on a hind legs or towards tail, see, it will take more time. It will take more time. So this, if we remember this, then we can plan accordingly, and we can even guess the incubation period in the animals. So rabies, actually primarily it is a disease of canines, but it sometimes occurs in the cattle due to bite by a rabid dog bite. In cattle, incubation period is 2 weeks to several months. Usually it is 3 weeks. It is 3 weeks. But I have seen cows, they exhibited symptoms even at the on 6th or 7th day of dog bite. Average course of the disease is 3.7 days. It is 3.7 days. Usually it is 3 to 5 days. Very rarely the cattle or a buffalo, they may survive up to 7 days or usually it is 3 to 5 days. The disease occurs in 2 different forms, that is the furious form and a paralytic form. So furious form, it is characterized by the signs of restlessness or excitement. So here animal is very aggressive. Where animal is aggressive, it is hypersensitive to touch and noise. It attacks violently. It attacks even trees and walls. So violent or attacking type of the behavior is found. Then frequent loud bellowing. So bellowing without reason. Bellowing without any reason, and that too loudly. That is a typical feature of a mad disease, that is a rabies. There may be a sexual excitement, particularly in the male animals. Even females, they may exhibit the signs of heat. And the male animals, they are also excited. And the typical sign, another typical sign, which is very typical of rabies, maybe a furious or a paralytic, that is a salivation. So in cattle and buffaloes, it is mostly a furious form of rabies. In 70% cases, it is being observed. Paralytic form is also observed in 30% cases. And this form is characterized by drooling of saliva. Here the saliva drools from the mouth, and there may be a voiceless bellowing. See, in furious form, they are bellowing with a hoarse voice. Whereas in case of paralytic form, animal makes attempt to bellow, but it cannot produce any sound or voice. We call it a voiceless bellowing or a yawning. It is called as yawning. The another typical sign found in case of a paralytic form of rabies in the cattle, that is a paralysis which starts from hindquarters. So from the hindquarters, the paralysis starts. There may not be any sensation in the hind legs first. Then that sensation gets reduced all over the body. And this is the another sign which I have seen in many animals suffering from rabies, that tenesmus with the sucking anus. There is a straining while defecation. Straining while defecation, actually animal doesn't pass its feces, only it shows continuous straining, and there is a sucking type of anus. In case of dog and cat, which is very typical, in dogs also, 2 forms of rabies they are being observed, furious form, and another is the the dumb form of the rabies. In dogs, the furious form is more common again, and these are the 3 stages, even in furious form of rabies in the dogs. Stage of melancholy. So this is the very initial stage. This is the initial stage, prodromal type of the stage, in which the dog hides in the corner. It is having a photophobia, fear for light, doesn't go in a sunlight, hides in a dark corner in a house. There is a change in behavior. The important thing is the disobedience. So usually it does, the affected dogs, they doesn't obey the masters, and they develop the tendency to bite, increased tendency to bite. Second stage is very typical, and the rabies can be very well diagnosed during the second stage. That is change of voice, and during the stage of excitement again the dog barks with a louder and hoarse type of voice. It is not normal voice. It is a rough, it is a hoarse type of voice. During this stage, the eyes are red shot and dog wanders aimlessly without any reason. It moves here and there, and that too with a straight tail, biting without provocation. Even a good dogs, healthy dogs, they can bite others, human beings, but that too on provocation if you instigate them. But here the dog is biting other animals, human beings, without any provocation. This is a typical sign. There is excessive salivation. There may be a sexual excitement in both males and females. Third stage, it appears, that is the stage of paralysis, which appears like a dumb form of a rabies. And this follows the stage of excitement. Here there is a hanging of lower jaw. That is very typical. When you see the mouth is open. So here, even not only in dogs, even in other animals, I have seen that the dog animal keeps its mouth open. Tongue is hanging and saliva is drooling times. And animal is unable to close the mouth and even unable to drink and swallow the food. And here you will also find a ascending type of paralysis. The dumb form of the rabies. See, in dumb form also, the first and third stage of furious form. In furious form, we have discussed three stages of rabies: stage of melancholy and excitement and paralysis. So here, the melancholy stage and the paralytic stage, they are evident. There is no excitement as such. This is most common in dogs. Most common in dogs. Dog hides in the corner, unable to bark. See, in a first form, that is a furious form, dog barks without any reason. And second, the barking is with hoarse voice. But in a paralytic form, the animal tries to bark, but it cannot produce the sound. It cannot produce the voice. We call it as a aphonia. So unable to bark, unable to close the mouth, drop jaw, already I shared, drooling of saliva, and usually the affected dogs, they die within 7 days. What are the signs observed in human beings? In human beings also, two forms of the rabies, they are being observed: classical or a furious form, which is common in 80% cases of 80% cases, where the dumb form is observed in only 20% cases. Even in a classical or a furious form, 3 stages like a dog, they may develop. And in a dumb form of again, it is more or less similar to that of dog, where the first and third stage is being observed. In the furious form, the signs of excitement they are observed. In a dumb form, those signs are missing. That is the only difference. Otherwise, the rest of the signs, they are more or less similar. This is the first and most important sign. This is being felt by the individual, that itching. Actually, the problem starts with itching or a local pain at the site of bite or wound. So this is a very important symptom. Numbness is observed, itching is observed, or felt, or local pain is felt at the site. Then the problem starts with headache. Headache, then malaise, insomnia sometimes, and fever, mild to moderate fever may develop in affected individual, maybe within 2 or 3. The affected individuals may show the signs of hypersensitivity to noise, air, and light. It's called as aerophobia. So the individuals, they have phobia, or they have fear for the air. We call it the aerophobia. They have also fear for the light, photophobia. Hallucination, seizures, and bizarre behavior, or aberrant type of the behavior and even convergence may be observed in the affected individuals. Hydrophobia is a typical sign in a human. It is a typical sign of human rabies. It is not observed in animals. This is very interesting. Hydrophobia is a synonym for human rabies, not for animal rabies. So here there is a fear for water because of spasms of you see the throat, spasms of the muscles of the throat. Animal is unable to swallow the water. There is difficulty in swallowing. Even a sore throat may be exhibited or expressed by the individual. Difficulty in swallowing, dysphagia, and excessive salivation is also being observed in affected individuals. The duration of illness is 2 to 3 days, and very rarely the individuals may survive for 5 to 6 days. The disease is being diagnosed by the different methods that are being recommended. Fluorescent antibody technique, an impression smears from the brain can be completed in 2 hours, highly accurate, 99% reliable. Dot ELISA, rapid, simple, and economical. This is 90%, 95% histopathology. The typical Negri bodies they are found, and even recently this RT-PCR has also been recommended for the confirmative diagnosis of rabies. And you all know that for diagnosis of the rabies, brain is to be collected. In ailing animal, again, this saliva and the corneal impression smears they can be used for RT-PCR. As far the treatment is concerned, this disease is not to be treated. There is no specific treatment, and it is 100% fatal once the signs develops. In all animal species, and therefore precautions should be taken by the caretaker to avoid bites. As far as the human beings are concerned, in animals we are not recommending any treatment. Nobody is undertaking the treatment. So once the diagnosis of rabies is being made, animal is being kept under observation. And there is no question of any response to the even a treatment if it is a rabies. But doctors, they will have to make a differential diagnosis of the various diseases characterized by nervous signs in animals, and sometimes the diseases which are showing nervous signs due to animals showing nervous signs due to some other diseases, they are also mistaken as a rabies and they are not being treated. But whenever the nervous signs are observed in animals, always rabies should be considered in a differential diagnosis. It should be considered on a top priority in the differential diagnosis. And hello, and it must be differentiated from the other diseases. But sometimes because of fear of a rabies, even the animals suffering from other nervous disorder, they are not being treated. Here in human beings, if the patient is admitted for a treatment, in that case the caretakers, they will have to take care to avoid bites and saliva contamination of mucous membranes and wounds by using the personal protection equipments. Keep the patient in a quiet room with a subdued light and protect them from stimuli. So this is what required, because they are very hypersensitive. They are sensitive to light, they are sensitive to noise, they are sensitive to air, and therefore patients, they are to be kept at a quiet place, and they are to be protected from external stimuli. The individuals, they are being sedated. This is required. Sedation with diazepam or chlorpromazine is recommended, and the fluid therapy can be given by intravenous route. It is 100% fatal. Till now, there are only reports of 7 cases. Very recently, I come across with one reference that 14 patients, they have been survived in the last several years. Prevention of human rabies. How to prevent rabies in human beings? These are our 3 main objectives or principles of prevention of human rabies. Management of the wound. Proper management of the wound is required. That is caused by dog bite. Passive immunization with rabies immunoglobulin. So passive, this particular immunization will provide a short-term immunity of a short duration, that too in the initial period against the rabies. Then active immunization with anti-rabies vaccine. This provides protection for a longer duration. So these are the three main principles and objectives of the treatment. First, we will discuss management of the wound. So immediate and thorough cleaning and flushing of wound for a minimum 15 minutes using a soap water. This is very, very important, and there is need to create awareness among the children, students, people, farmers, everyone about the importance of flushing the dog bite wound, flushing the animal bite wound, even with a simple tap water. Even if soap is not available, just flush the wound with the tap water for 10 to 15 minutes. If soap water is available, it's well and good. Thorough cleaning, thorough washing of the wound, that will prevent the rabies to the extent of more than 80%. See, this is a very simple measure which helps us a lot in prevention of the rabies, and this is to be followed by everyone. Second, the use of antiseptics, virucidal antiseptics. These are again easily available at every place. The spirit is available, alcohol is available, or povidone iodine is available. So iodine or alcohol or a spirit that can be very well used for cleaning the wounds. Wash the wounds, flush the wounds, wash it with the soap water, and apply alcohol or a povidone iodine liberally. This will prevent the rabies to the greatest extent. One more thing, sometimes the bitten wounds, they are very much severe. They are very much severe, and suturing is advisable in those cases. In general, what we recommend, avoid suturing. Avoid suturing. No suturing should be done if it is a dog bite wound. But sometimes, if it is required, if the wound is very vast, if it is very large, in that case, suturing may be inevitable. In that case, it should be done after 24 to 48 hours, and that too after infiltration of immunoglobulins locally. So flush the wound, clean the wound, infiltrate the immunoglobulins, and then you can go for a suturing of the wound after some time. And again, take minimum number of sutures. Minimum number of sutures possible. Then avoid covering the wound with the dressings or bandages. So bandaging is not advisable. So this is again the important thing. Then don't apply irritant drugs, acids and alkalis. In the old days, it was being recommended, carbolic acid was being recommended for cauterization of a rabid dog bite wound. Nowadays, we are not recommending. There is no need of using a very quadrant type of drugs. Maybe a calcium hydroxide or a carbolic acid that will create a scar, and there is no need. Even a simple iodine, simple povidone iodine or alcohol is helpful. If the wound is very much contaminated, if the wound is very severe, in order to avoid the sepsis, we can go for a use of antibiotics like amoxicillin, fluoxetine. We can complete a course of 3 to 5 days and antibiotic course. Then whether the tetanus toxoid is required, VTS is required. In my opinion, if wound is properly cleaned, flushed, and spirit is applied, and if a course of 3-day antibiotic is being completed, no need of giving even tetanus toxoid. But if you think that the wound is very deep, if wound is very worst, in that case, even anti-tetanus toxin can be given, or tetanus toxoid can also be given. This is all about the care of wound. Second is the passive immunization. Passive, it provides immunity for just 10 to 14 days. So in the initial period, it provides the protection. Two types of, you see the immunoglobulins, they are being used. Rabies immunoglobulins. One, that is equine rabies immunoglobulin. So these are the immunoglobulins raised in equines, horses. Human rabies immunoglobulins. In human being, generally we give preference to the human rabies immunoglobulins because the adverse reactions, they are negligible with human rabies as compared to the equine rabies immunoglobulin. So equine rabies immunoglobulin is also available in 300 international units per ml, and the dose is 40 units. It is double to that of human immunoglobulins, and immunoglobulins 150 units per ml. These are available in a 2 ml ampoule, and the dose is 20 international units per kg with maximum 1500 international units. And of the total calculated dose, 50% dose should be given locally and 50% should be given deep intramuscularly. It can be given up to 7th day of first dose of ARV, but here I would like to say it should be given immediately or within a short time after the dog bite, because it is being given to protect, give protection to the individuals in the initial days. But if suppose there is delay, if it is not being given, then we can give it even up to 7th day. Then third is active immunization. 3 types of anti-rabies vaccines, they are available in the market: human diploid cell vaccine, purified chikungunya cell vaccine. So cell vaccines, they are nowadays available. In old days, the nervous tissue vaccines were available. Those are now outdated, and those are now nowadays not recommended, not being used, having several type of the side effects, and they're less potency. These are more potent vaccines. They are very safe, and they are producing very good immunity. Reconstituted vaccines, but one thing has to be remembered, that reconstituted vaccine be used within 8 hours. Interswitching between different cell culture vaccines is not recommended. So you start a course of one vaccine, so same vaccine needs to be continued. All vaccines must have a potency about 2.5 international units per dose that is being recommended. The prevention of human immunization schedules. These are the 3 schedules, immunization schedules, they are being advised. Schedule A, this is pre-exposure immunization. Means this is being given before dog bite. This is being given before dog bite. This type of schedule can be given in dogs. We are advising it in dogs as well as cat, in animals as such. And in case of the peoples having high risk, this schedule A is being advised. 1 ml intramuscular that is to be given. Now intradermal vaccines, they are also available. The dose is less, 0.1 ml at 2 different sites intradermally, that is being advised on day 0, 7, 21/28 days. So only 3 doses they are recommended in human beings. In animals, we are recommending only 1 dose and booster dose after maybe 1 month or so. And in human being, generally, first dose is to be given on a day 0, second on 7th day, third maybe at 21st or 28th day. So these 3 doses, they are to be given within the first month, and thereafter we can go give a booster after 365 days. Again, this can be repeated after every 3 years, but in high-risk persons, it is better to give a booster every year. It is better to give booster every year. Schedule B, post-exposure prophylaxis. Here, the 1 ml intramuscularly in a deltoid anti-rabies vaccine is given in the deltoid muscles, or 0.1 ml at 2 different sites intradermally on day 0, 3, 7, 14, and 28. So this is a post-exposure prophylaxis where 4 to 5 doses they are being given. Generally 5 doses, and for you see this intradermal vaccine, 1 dose, the 4 doses, whereas for intramuscular vaccine, generally 5 doses they are being given. First 0 day, second 3rd days, third 7th day, 4th 14th day, and 5th 28th day. And if required, it can be repeated even after 90 days. Schedule C, concomitant post-exposure prophylaxis. This is the 3rd schedule. As per Schedule B, means this is to be repeated, and along with that, human rabies immunoglobulins, they are to be given 50% at the site of bite and 50% by intramuscular. Here, what is day 0? Day 0 indicates the date of first injection, and deltoid region is ideal for intramuscular injection, in case of the human beings, and gluteal region is not recommended because more fat which retards absorption of a rabies antigen. Then category of exposure. Whenever there is a wound, whenever there is a dog bite, animal bite, it needs to be categorized into three. So these are the three categories met based on the nature of wound or based on its nature of exposure. Category 1, contact with a rabid or suspected animal, touching or feeding animal. Here only the particular person has touched the animal or fed the animal. No contact with saliva, skin is intact, no immunization is required. Category 2, here animal has licked your exposed skin. Means there is a wound over the skin and animal has licked over the skin, contact with saliva, but skin is intact. Skin is good, skin is intact, there is no wound over skin, but rabid animal has licked over the skin and applied the saliva. And third, there are minor scratches, abrasions without bleeding. So these type of wounds are categorized under this category 2. And here schedule B is recommended if rabid animal is there. If it is a rabid dog bite, then schedule B. That means you have to give 5 injections post-bite course. And if it is a non-rabid animal, if it is a healthy animal, just give 3 doses. So that difference we'll have to make. Then the category 3, here all types of bites where there is an open wound, bleeding scratches are there, all scratches on head, neck, scapular region, arm, hands, there is contact with the saliva and even contact of saliva with the mucous membrane. See, in this category, contact of saliva with intact skin. So there we are following schedule B or schedule A, whereas whenever there is a contact with mucous membrane, we have to follow this schedule C. Schedule C comprises the all 5 injections of rabies vaccine with human rabies immunoglobulins. Whereas in case of non-rabid animals, if the dog is healthy, in that case, just 3 doses are sufficient. So we'll have to consider the categories and the schedules. Accordingly, we have to manage. Then, how to prevent the rabies in animals as such? Actually, the guidelines given for human beings, they are more or less same for animals, except the mass immunization has to be carried out because the dogs, they are the major reservoir host, and therefore the mass immunization of dog is recommended. In human beings, we are not recommending mass immunization. We are recommending only immunization after exposure. So here, mass immunization of the dogs, regular vaccination of the dogs, first dose is to be given at the age of 3 months, because up to 3 months there is a passive immunity. So first dose is to be given at the age of 3 to 3.5 months. And then annual revaccination is to be carried out. Vaccination coverage of 70% dogs is required. Unless and until we vaccinate 70% of the dog population, we cannot control the rabies in the dogs. Control of stray dog population. I already shared that 35 million dogs, they are street dogs in our country. So that is the major problem. Registration of the pet dogs that is to be made, and vaccination is to be made compulsory, and the awareness programs, they are to be arranged. They are to be by maybe NGOs, animal welfare organizations, the veterinarians, and the human health workers. Rabies diagnosis and surveillance is also required. So in my opinion, education is most important. So education of the people, education of the children about the rabies is required on an extensive scale. Be careful and act responsibly around the stray animal. Whenever you will find a stray animal, we must be very much careful. Learn how to recognize an animal with rabies. So everybody should be aware of the signs of rabies. Then only he can identify the rabies suspected animal. Know how to avoid the dog bites. Learn about dog body language. Don't run. Many times, maybe because of fear, the children, they start running. Means they start running when they see the dog. So running will attract the attention of the dog, and the dog is likely to catch and bite. So don't run, scream, or throw anything at an animal. Even the children, they have a habit of throwing stones towards the dogs, and therefore they get angry, aroused, and they bite the children. Don't disturb animal who is sleeping. This is again very important. The dogs which are sleeping, eating, or the females which are carrying their pups, if they are disturbed, they are likely to bite. When growing dog approaches you, don't run away. Instead, stand still. This is very important. When dog is aggressive, it is coming towards you, it is approaching you, stand still. Wherever you are there, you stand still. Keep your arms down and hands close to your body and look to the ground. Don't look into the eye of dog. That will avoid the dog bite. There are many questions, doubts raised about the rabies by the common public and people. Who should get anti-rabies vaccine? This is very important. I already shared all dogs, pet dogs or maybe street dogs, they need to be vaccinated regularly. Annual mass vaccination has to be carried out. But as far as the human beings are concerned, we don't recommend mass vaccination because animal bites are less, and so it is not feasible, not practicable, and not economical. So here in human beings, what is being required? The persons who are having high risk occupational group, such as vets, all veterinarians, they should complete a regular course of vaccine. Their staff means compounders, dressers, attendants, animal handlers, rabies researchers, scientists, and certain lab workers. So they are expected to take preventive or doses of anti-rabies vaccine. Persons who are in contact with cats, dogs, they should also protect themselves. International travelers, they are also expected when they are traveling from the non-endemic to the endemic area. Can the vaccine protect if you have already been exposed to rabies? Yes, there are good vaccines nowadays available in the market. If we take vaccines regularly, if we complete the proper course of vaccine, and if we start it on time, then definitely they will offer the protection. They will offer the protection. One important and interesting thing I would like to share, that fortunately, the incubation period of rabies, usually it is around 14 days. Very few cases, the incubation period is shorter than 2 weeks. Usually, in 2 weeks after giving vaccine, the immunity develops and it provides the protection. Do you have to take vaccination against rabies if a vaccinated dog bites you? This is very important. If you are carrying out a regular vaccination of the dog, and if suppose this regularly vaccinated dog bites to you, in that case, the chances of rabies are negligible or nil, nearly nil. And therefore, there is no necessity of taking a course of vaccine in general, theoretically speaking. But here, one thing we'll have to remember, if the dog is properly vaccinated against rabies and the efficacy of the vaccine is confirmed by laboratory evidence, this is not possible everywhere. This is not possible. If a titer is good, then there is no need. Otherwise, an appropriate post-exposure prophylaxis should be given. To safeguard the interest, I am of the opinion that even if you are healthy, a regularly vaccinated dog bites to you, take at least 3 doses of anti-rabies vaccine. If I am beaten by a rat, do I require post-exposure prophylaxis? Many times the people, they ask, I'm beaten by a rat. Actually, rat rabies is rare, but it has been reported from some Asian countries. Although it is rare, it is not necessary to take. It has been mentioned that post-exposure prophylaxis in bite cases by house rats. However, it is prudent to take this PP in consultation with the infectious disease. Here again, I would like to share, rat rabies is very rare. It is very difficult to differentiate whether it is a house rat or maybe a wild rat or like that, and therefore better to take 3 doses of, you can see, the PEP. Is PEP necessary if milk or milk products from an infected animal are consumed? Now it has been made very clear by the WHO that the virus is not secreted through the milk, and therefore it is not spreading the disease. So there is no necessity of taking any course of vaccine, because there is no laboratory or epidemiological evidence that the consumption of milk or milk product from rabid animal transmit the disease. However, this is very important, and this is to be remembered by the scientific community and all the people, that it is not advisable to consume milk from a rabid animal. Always we should consume the milk. Always we should consume wild milk, pasteurized milk, so it will be free of rabies virus. Can a consumption of meat from an infected animal transmit the rabies? Again, the consumption of raw meat from an infected animal requires PEP, because in raw meat there may be even a nurse and all these things, so the chances of infection are there. So one who is consuming the raw meat, he should take post-exposure prophylaxis. But cooked meat doesn't transmit rabies. Virus doesn't survive in a cooked meat. However, it is not advisable to consume meat from an infected animal. This is again, if it is known rabid animal, don't use it for a meat purpose. What does the post-exposure treatment include? Treatment after an exposure in a previously unvaccinated person requires receiving a dose of rabies immunoglobulin and 4 to 5 doses of vaccine. This treatment has never been known to fail. This is very important. This combined treatment, human rabies immunoglobulins and 4 or 5 doses of vaccine, anti-rabies vaccine, will provide 100% protection to the individual. If you are giving only vaccine, there is no guarantee of 100% protection. But if it is being given along with human rabies immunoglobulin, then definitely there will be a 100% protection. Is a vaccinated person totally protected if bitten by a rabid animal? For example, if a veterinarian is vaccinated regularly, if it is protected, then what to do? Regularly protected against rabies. And if he is bitten by a rabid animal, then what to do? Here, a vaccinated person should receive 2 more doses of rabies vaccine, because he has already received 3 doses of vaccine. So he has to take only 2 doses. This is the advantage. Why to take prophylactic anti-rabies vaccine? So we can only give 2 doses. One more thing, 1 dose immediately and 1 dose 3 days later. This only 2 doses, 0 day and 3 days. That 2 doses they are to be given, and there is no need of human rabies immunoglobulin. This is the added advantage of you see, undergoing preventive vaccination. Can a pregnant woman receive rabies vaccine if exposed to rabies? Yes. No fetal abnormalities have been reported. What side effects have been reported with this vaccine? The newer type of the vaccine, cell culture vaccines, these are very safe and the adverse reactions are minimum. Most reactions to this vaccine are mild, and such mild reactions, particularly they develop with the intradermal type of the vaccines. The local swelling may develop, or slight soreness or pain may be there, or redness may appear at the site. Moderate problems, sometimes there may be pain, slight swelling, and fever may appear. Occasionally, GI disturbance may develop. Very rarely, anaphylactic shock may develop. But as far as the side effects are concerned, they are minimum with the newer vaccines. Who should not receive the rabies vaccine? The rabies vaccine is not recommended for routine use in the general population. Again, a sick animal, sick person, they should not receive the vaccine. What is the rationale for 10 days observation? We recommend 10 days observation. Whenever any dog bites, we ask the animal owner to keep that dog under observation for 10 days. This is required and this is you see suggested. Because virus is already, I have made it clear that virus is secreted through saliva before 5 days of onset of illness, and in next 5 days, dog shows signs and may die within 5 days or so. And therefore, 10 days observational period is recommended. But during this period, the treatment should not be withheld. If there is a history of dog bite, you see the post-bite prophylaxis program should be undertaken. We should not wait till that dog survives or dies. But here I would like to make it clear, if suppose the dog remains healthy by 10th day, just 3 doses are sufficient, and no need to go for a 4th and 5th dose. That is the advantage if you keep the dog under observation for 10 days. It should not be killed. Many times the dogs, they are being killed, and even healthy dogs, they are being killed, apparently healthy dogs, and so it is difficult to trace out. So we should not kill the dog. We should keep the dog under observation, and if it proves healthy, no signs, only 3 doses they are required. If it dies, it is showing the right signs of rabies, 2 more doses should be given. What is the fate of those people who are diagnosed as rabies? It is 100% fatal in human being. 7 human patients survived of rabies in the world. All patients received rabies vaccine, but none had rabies immunoglobulin. This is very important. The human beings which received the post-bite vaccination schedule, they exhibited the signs. Those were comparatively milder, and those patients only survived. The only one patient, that is a 15-year-old girl, of the rabies 1 month after being bitten by a bat, survived, who did not receive any post-bite vaccine. That is the only example. So without vaccine, that girl survived after intense medical therapy with antiviral drugs and sedatives. Actually, antiviral drugs in rabies, they are not effective. They have been tried. Maybe mild case survived. So my sincere thanks to our Honorable Vice Chancellor for giving us permission to organize this webinar. And thanks to Alembic Pharma. Thanks to Dr. Markande sir, Associate Dean, COVAS Parbhani, and Dr. Syed, in charge TVCC, TVCC COVAS Parbhani, for organizing this webinar. I am also thankful to my colleagues for all the help rendered by them. Okay, thank you all. If there are questions, we'll definitely take up those questions.
Thank you, sir. Thank you very much. It was a very nice and very detailed presentation on rabies, sir. Today we are also celebrating the World Rabies Day, and there are many professionals who have always questions, queries, and problems related with this type of cases. Sir, rabies, when we are treating in the clinics, in case of bulls particularly, animal owners are always impatient about the condition of the animal and the strategy to be adopted in case of clinical cases. But I'm sure that with your detailed address of this particular disease, symptoms, treatment, preventive measures, and also the public health aspects which you have covered during your lecture, those will be definitely useful for we all. Preventive type of vaccination, we regularly go for this disease. Our Director of Research had started annual vaccination program in case of the dogs, and that particular move we have carried out at Parbhani Veterinary Polyclinics since last 10 years. Many times we have organized seminars, dog shows, and awareness type of campaigns. This year it was not possible, and therefore Alembic friends, they were with us to support us
to organize this particular webinar for field veterinarians and also for student friends. Really speaking, Alembic is involved with veterinary clinicians, and the company is interested to support knowledge series to the veterinarians. Karunanidhi ji, Dr. Shinde ji, we are very much thankful for you for providing this opportunity through your forum. Indeed, it is a matter of great pleasure for we all that this particular program is under the guidance of our Director of Instructions, Director of Research, and more particularly Director of Extension Education. Dr. Aher sir is with us to guide us on this particular occasion. I remember successful organization of many rabies days at Parbhani, and I'm sure that the points which have been contributed to us by Professor Dr. Bhikane sir, those will be definitely useful for us to deal with the cases of rabies. On behalf of Parbhani Veterinary College, who has only contributed to organize this particular seminar, but Dr. Mujib, Dr. MF Siddiqui, and Dr. Bankar, Dr. Ingavale, and other clinicians from PGIVAS Akola, they have taken a lot of interest in this particular webinar. I am thankful to all of them. And now I request our Director of Extension Education, Dr. Aher sir, to guide us on this occasion, World Rabies Day. Sir, please.
Sir, you are not audible, sir. Sir, you are not audible, sir.
काय प्रॉब्लेम आहे? हॅलो हॅलो संतोष.
Sir is not audible, sir. Aher sir.
हा.
Santosh,
Yes, sir.
you might not have selected this audio setup because he is muting, unmuting, but still his voice is not coming. Now it is muted. Sir, please unmute yourself, sir. Agar sir. Now you speak, sir.
No, sir, you remove the headphone, sir. It will work.
Sometimes it may be. Please use computer audio, sir. Santosh, I think headphone to be removed from the laptop. अभी अनम्यूट कीजिए सर.
Hello, am I audible?
Yes, sir.
Now audible, sir.
Okay. Thank you, Dr. Markande, Mr. Karunanidhi ji, Dr. Santosh Shinde, Dr. Bhikane. So I first congratulate to the speaker for a nice deliberation and to the organizer, knowledge partner, Alembic Pharma. Mr. Karunanidhi, Vice President, and Dr. Santosh Shinde for providing this partnership and providing the platform for deliberation of this important topic to the dog owner and veterinarians. So, rabies is a dreadful disease and it causes havoc whenever there is a bite from a rabid dog. Naturally, whosoever bitten and his family members. So I recollect two of the stories which I want to share here because this is a very important topic. And one of the leading practitioner and his son was beaten by his own dog pet, and he was suspecting, he was worried about the rabies, and then the dog was died immediately after bite. 3-4 days, the dog was died, and then it was suspected, and then how to get it diagnosed, that was a problem. Then anyhow, we could collect the brain from the dead dog with the help of one of our supporting staff worker, and then it was sent to then Bombay Veterinary College, now Mumbai Veterinary College, and with personal communication with head of the Department of Microbiology, Sirkar Madam, it was processed and it was diagnosed as positive for rabies. And then it made havoc and then treatment was continued. The boy was saved. He was son of Dr. Bhalerao, Chandrasekhar Bhalerao, who is now their Dex Pilani graduate and working. So this is how the incidents I quoted, because after that the post-exposure schedule was followed and he was saved. Likewise, there was another incident from Darasur, that is the village where there is a veterinary dispensary grade 2, and in that village before Sankranti, 14th January, the dog, rabid dog came and he was beaten to 40 and more animals, and 40 animals were showing the symptoms of rabies, and that made havoc. And then some of them were milking buffaloes, cows, and the animal were suspected or showing the symptoms, and most of the animal owners were exposed to them, and then there was havoc whether it will be transmitted to the animal owners, and that's why they had representation and the news flashed through the newspapers, and then our team visited there. Myself and head of the department medicine, Dr. Digraskar. Then we oriented and counseling of the owners were done, and we observed the patients, and they were tied with the long rope to the trees outside the village, and they all were showing the symptoms, and they died. And then the meat of the dead animal was eaten by the dogs, and they spread up, and it was just like a pandemic, like outbreak in that village, and it was controlled by counseling, by vaccination of the other animals, and vaccination of the even humans was advised, and it was controlled. This is how there were two incidences recollected regarding the rabies, because there is no treatment. It says there is no treatment, but after treatment, post exposure, all the animals were saved, and no death due to rabies from the human, also from that village. So this is how, when you follow pre-exposure, post-exposure schedule of the rabies, so naturally 100% we can't say, but the animals and humans can be saved with the vaccine, provided everything will go right in time. Otherwise, even after severe bite and administration of immunoglobulins at the site, there are death reported. But with due precautions, with prophylactic measures and post-bite exposure treatment with scheduled vaccination 0, 3, 7, 14, then 28, and optional 90 days. If it is followed strictly, rabies can be prevented. So that is the importance of the rabies, and the day 28th September, that is the day celebrated as World Rabies Day. And when I was there working in the Parbhani-PGIVAS college, every year we used to organize the free anti-rabies vaccination camp on this day. And prior to this day, 1 week earlier, we used to have training for dog owner with the various different subjects, with various things. It was celebrated every year in COVAS Parbhani, and that was the tradition started from 2008 by me as an in-charge CBCC. This I should pass on the information. This is how the Institute College of Veterinary Animal Sciences Parbhani has contributed for celebration of this World Rabies Day event every year, with organization of dog owner training, orientation camps, and then free rabies vaccination camp on the 20th September. Okay. So this is how it can be prevented, and the theme for this year is let's end rabies through collaboration and vaccination, that we have followed every year. This year also, by participating in the webinar and the speech of Dr. Bhikane, webinar organized by COVAS Parbhani jointly and PGIVAS Akola under the aegis are with the guidance, under guidance of Maharashtra Animal and Fishery Sciences University, Directorate of Extension. So this is the activity in partner with the knowledge partnership of Alembic Pharma. So this is the event, and it was found fruitful. And I congratulate the speaker, and I extend thanks once again. Thank you all.
Thank you very much, sir, for your kind address to the audience who have joined to this international webinar globally. I'm very much glad to have your remarks, as well as the remarks, the concluding remarks of Professor Markande sir, Associate Dean COVAS Parbhani. I'm glad to share that the PGIVAS Akola, the organizing institute, is also conducting the anti-rabies vaccination camp at our teaching veterinary clinical complex for this week. Today we have vaccinated about 200 dogs, and many more we are vaccinating for anti-rabies in this week also. So for this program, the Robin Hood Army of Akola as well as the Virbac company have supported a lot, and I'm on this platform, I wanted to extend my warm greetings to that supporters also. Now, I would like to share. I would like to request Dr. M.V. Ingavle sir to offer his vote of thanks.
Thank you, Bankar sir. Now, I am thankful to the chairman of today's international webinar, Professor Colonel Dr. A.M. Paturkar sir, Honorable Vice Chancellor MAPSU Nagpur, for accepting our invitation to act as a chairman for today's webinar and permitting us to organize this international event on the occasion of World Rabies Day. The Institute is highly thankful, sir. Now, I am thankful to Professor Dr. Respected A.P. Somkowar, sir, Director of Extension and Dean, MAPSU Nagpur, Respected Professor Dr. N.V. Kurkure, sir, Director of Research, MAPSU Nagpur, and Professor Dr. V.D. Iyer, sir, Respected Director of Extension and Training, MAPSU Nagpur, to be as a guest of honor for this today's international webinar. Now, I am very much thankful to Mr. Karunanidhi, sir, Senior Vice President, Alembic Pharma Limited, to be the chief guest for today's function and introducing the eminent speaker on this for this international webinar on Let's End Rabies through Collaboration and Vaccination. Now, this is the first joint venture organization of the international webinar along with College of Veterinary Animal Sciences, Parbhani and PGIVAS Akola. I am deeply thankful to convener Dr. N.M. Markande, sir, Associate Dean, College of Veterinary and Animal Sciences, Parbhani, for this permission and successful organization of this joint international webinar. Now, I am thankful on behalf of the organizing committee to the eminent speaker, Dr. A U Bhikane, sir, Associate Dean, PGIVAS Akola, and President of VIPM, for sharing the highly knowledge enriching on aspect of the control of the rabies through the collaboration and vaccination and strategies for this control of this rabies. Thank you so much, sir. Now, I am thankful to the Alembic Pharma for this acting as knowledge partner and providing this online platform for this international webinar. So, organizer and university is highly thankful, sir. Now, I am thankful to the organizers from the College of Veterinary Animal Science, Parbhani, Dr. A.M. Saeed, Dr. S.V. Gaikwad, Dr. M.F.M. Siddagi. I am from PGIVAS Akola, Dr. P.S. Bankar, Dr. K.S. Pazai, to organizing this international webinar to share the knowledge and enrich the knowledge of the veterinarians on this very auspicious occasion of the World Rabies Day. Now, I am thankful lastly to all the participants, students, and the veterinarians for spending their valuable time and participating this international webinar on the occasion of the Rabies Day. I am thankful to the team member, Dr. Santosh Shinde, sir, and all the veterinarians of Alembic company for hosting this international webinar. Lastly, I am thankful to all the persons who are directly or indirectly involved in this successful organization of this international webinar. And I think more than 700 participants has been registered and was live for this international webinar. This is a
Thank you very much, sir. Now I would like to request Dr. Santosh Shinde, sir, from Alembic Pharmaceutical Limited, to offer a vote of thanks from the knowledge partner, please.
Thank you very much, Praveen. Warm and graceful evening to Honorable Bhikane, sir, and Honorable Markande, sir. It is my privilege to propose vote of thanks speech and acknowledge the contribution of those who really work hard to make this webinar successful. On the behalf of all the participants, Alembic Pharmaceutical Limited, I would like to thank Dr. Honorable Paturkar sir, Vice Chancellor, Honorable Markande sir, Associate Dean, COVAS Parbhani, Somkowar sir, D and Dean, MAPSU, Dr. M.A. Kurkure sir, Director of Research, and Dr. Ahi sir, Director of Extension and Training. I express my sincere gratitude to Dr. Bhikane sir for such an informative presentation on Rabies Day. And sir, this your presentation will help student, faculty, field veterinarian, and researcher to achieve one health mission. Sir, we are like to take this benefit of such interesting session in future, so that we will upgrade our knowledge and we can serve the society. I would also like to thank the organizing committee, starting from Dr. Syed Muzim, S.V. Gaikwad, MF Siddiqui, Mahesh Ingole, Dr. Mahesh Ingole, Dr. Praveen Barkar, to making this webinar successful. Last but not least, I will like to thank all the participants, near about 629 participants throughout the session or on live on the from Digital Info Media online platform, and also Alembic field staff and HO team and my PMT team for making this webinar successful. Thank you once again, Dr. Bhikane sir and Markande sir and all the participating veterinarians. Thank you, sir.
Thank you, sir.
Thank you, Santosh.
सर थँक्यू.
Thank you, sir.
खूप डिटेल झालं, मस्त झालं एकदम.
बरोबर
5:15 जॉईन झालो होतो सर.
बरोबर, तुम्ही आलात म्हणजे बरोबर.
नाही थँक्यू सर. चला ओके.
ओके सर.